The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy, a local Health Mart pharmacy. I'm your pharmacist, Paul White. We're glad you joined us today. Before we begin, I'd like to thank our sponsor, Studio Arts and Glass, Kiko Auctions, and of course, our technical producer, J.D. DeAngelis. In the studio with me is Brad Wade, a compounding pharmacist, and our very special guest from Altman Hospital, Audiologist Mitch Polen. Good morning, Mitchell, and welcome to the show.
Good morning. Thank you very much for having me. According to the Hearing Loss Association of America, statistics indicate that it takes a person an average of 7 years from the time they think they have hearing loss until they seek treatment. Hearing loss can affect balance, relationships, the ability to understand, and much more. Today we're going to talk about the different types of hearing loss, what a person can expect when they seek treatment, as well as learn about the differences between hearing aids and cochlear implants. We're also going to talk about hearing aids and why they're so expensive and learn about tinnitus. We'd also like to remind our listeners today that our program is available on our podcast, which can be downloaded from the App Store on your favorite mobile phone. You can look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime. If you have questions you'd like addressed today, you can post them up to our live Facebook feed or give us a call at 330-450-1480, and I would be remiss if I didn't wish my father and my sister a happy birthday on November 16th here today.
Amazing. Look at this card at the studio. Everybody signed it. Fabulous. Thank you very much. Okay, Mitchell, tell us a little bit about yourself.
So I am an audiologist currently working with Altman Medical Group. Our main office is located in North Canton at the North Canton Medical Center on the corner of Whipple and Glenwood. But we also see patients in Louisville, Canton South, Orrville, as well as Carrollton.
So you're in your office is in the building in Louisville with Dr.
Renneker is who I'm with in Louisville.
Yeah, okay.
Yep. So, and then down in Canton South is another location that I go to. I'm with Dr. Tony, Dr. Kruzmark, and Dr. Dianchin. That's right next to Canton South High School.
Okay. The new high school.
Yep, the new high school. It's very nice.
Yep.
So I am a North Canton native. So I went to Hoover High School. Following that, I did my undergraduate work at the Ohio State University, and then I went on to get my doctorate from the Northeast Ohio Audiology Consortium, which is it's a joint program between University of Akron, Kent State, and the Cleveland Clinic.
Wow. So I know that in the last several years, the scope of the practice of an audiologist has expanded. So what's the scoop now? What do you all do?
Yeah, so since 2007, it is now required for audiologists to obtain their doctorate. And with that, obviously, your scope of practice is going to expand a little bit. So we are trained to prevent, identify, diagnose, and treat hearing and balance-related disorders. So as far as balance is concerned, this is going to deal a lot with vestibular disorders. So we will help to diagnose things such as Meniere's disease, which is an inner ear disease which causes both hearing loss as well as vertigo, or things such as benign paroxysmal positional vertigo, which is a mouthful. People usually just call it BPPV, but that's another very common cause of vertigo, which is easily treatable, and that's something that we will help to diagnose. On the auditory side of things, obviously hearing loss is a huge part of what we do, but we will deal with other auditory processing disorders like tinnitus, hyperacusis, things of that nature. And we do work with people from birth all the way, every age. All right, maybe you can help me and our listeners out and help us maybe just define a little bit the difference between an audiologist and a hearing instrument specialist. Absolutely. That's a question that a lot of people ask. So if you are seeking treatment to get fit with a hearing aid, you're either going to be working with an audiologist or a hearing instrument specialist. Our scopes of practice are different. We have different training and educational requirements. So again, an audiologist is required to obtain their doctorate now for the last 10 plus years. So that's going to require 4 years of undergrad, 4 years of graduate school, a year-long residency type of year, which is purely clinical, passing a state licensure exam, and then, of course, continuing education to maintain that license. And as I previously said, we're going to deal with auditory and vestibular disorders mainly. A hearing instrument specialist, their training is usually going to be, I believe, a few months long, and they're going to be focused more towards just the sales and fitting of hearing aids for individuals over the age of 18. So mostly just a different requirements for training and education.
All right, well, how do we know if someone is beginning to develop hearing loss? And I don't know if that question should be, how do I know if I'm beginning to develop hearing loss, or maybe a loved one is beginning to develop hearing loss?
Absolutely. And you are actually exactly right. So a lot of times when I have a patient come in and I ask them, what brings you to me today? Oftentimes they'll say my spouse or my friend tells me I'm starting to have troubles. They tell me the TV's getting turned up too loud, or that they just don't feel like I'm hearing as well as I used to. Hearing loss occurs very gradually over a very long time, so the people that you spend a lot of time with whose hearing is still normal, they're going to know the things that you're missing even before you will in a lot of cases. So looking out for the TV going up, asking people to repeat themselves. Usually, if you're starting to notice hearing loss, you'll first notice difficulty understanding people in noisier, more complex environments. So that's something to look out for. Also, things like if you're starting to get ringing in your ears, that can be very commonly co-occur with hearing loss. So there's lots of different signs to look out for. Yeah.
Okay, so maybe I witness my spouse or a loved one that you walk in the room and the TV's really loud. So what's their first step if you have a conversation with them and say, hey, I think maybe you can't hear me as well as you used to, and then they'll get mad, and then maybe they'll think about it. How do you manage that situation?
Absolutely. So there is going to be that period where they're going to be a little bit in denial about it. But honestly, sometimes it can be something as simple as having earwax in your ears. So simply, if you suspect that you or a loved one has hearing loss, schedule an appointment either with your primary care doctor or directly with your audiologist. We will check your ears. We will do a comprehensive evaluation to try to figure out what's going on. It doesn't hurt to know. Knowledge is good. It's not a scary process. So yes, if you suspect you're starting to have a hearing loss, like with most health matters, it's better to check it sooner rather than later.
I'm kind of thinking, too, that, it's one thing to be proud and not want to have some help, but even if you're driving a car, if you can't hear audible cues that could save your life or someone else's, that's kind of scary. It's one thing with the TV, but, in those environments where you're trying to cross the street and you can't hear the car coming,
absolutely,
that could be frightening.
It is a safety issue as well. I had a patient a few years ago who I tested, and it was very sad. Before he was going to get hearing aids, before he came back, he was going out into the street to get his mail, didn't hear a car coming, and passed away that same weekend. And I couldn't help but thinking maybe if he could have heard it coming, it could have been a different outcome. So yeah, there are very real safety issues that you have to think about as well. Good point.
One comment to what you just talked about. Maybe the husband doesn't want to hear the wife, or maybe the wife doesn't really want to hear the husband. So how do you separate those?
There are mute buttons and volume controls on hearing aids, so that is not a good excuse anymore.
Okay. All right. So, what can a patient expect when you give them an evaluation?
So, like most appointments, when you're coming to see a healthcare professional, it's always going to start with taking a very thorough case history. This is a very important part of it. We want to try to determine if there's any possible underlying cause for the hearing loss. So we want to know about family history of hearing loss. Do your siblings, parents, grandparents have hearing loss? Is there some kind of genetic defect possibly that's causing it? We want to know about your history of noise exposure. Were you in the military around a lot of noise? Did you work in a factory type setting, which is really common here in Northeast Ohio over the last several decades? We want to know obviously about if you've had ear surgeries in the past, different medications that could possibly be ototoxic. And again, if you have ringing in your ears, that's something that can commonly co-occur with hearing loss. So just talking to start, getting a case history. Following that, it's important to check your ears because, again, it's possible you're simply plugged up with wax. If you are completely occluded, that can cause a mild to moderate conductive hearing loss. Obviously very easily treatable just by cleaning your ears out. And that is something that we will do before the exam, very frequently having to clean people's ears out, because that's going to affect the validity of the exam as well. So following that, there's an array of tests we'll run depending on the reason you're coming to us. Tympanometry is a test that will always run to analyze your middle ear function. So that's going to tell us if, if you have chronic sinus infections, maybe drainage that works up into the middle ear, that will give us an indication, tympanometry will, or if maybe the tiny bones, the ossicles in your middle ear space are starting to harden over time. This test simply gives us an indication of what could be going on. We'll also do something that most people are more familiar with, the pure tone testing. Familiar with this, just push the button or raise your hand when you hear the beeps. That hasn't changed much. Then we will do speech threshold and word recognition testing just to see how a patient handles a more complex signal. This can help us give an indicator of certain things, and also is a good indicator of how a patient will end up doing with hearing aids. And then there's lots of other tests that audiologists will run. Commonly, maybe for a first hearing evaluation, we would run something called distortion product otoacoustic emissions. And basically, this is a test that checks for a response from these tiny little hair cells in your inner ear. And these tiny little hair cells help to transmit sound to your auditory nerve. And these are also what tend to take a beating when you are exposed to loud noise for many years, or when you're taking ototoxic medications, things of that nature. So those are the main tests for your average Joe coming in for his first hearing test that you might run into.
I have to ask this question about ear cleaning. Ear candles.
No, please don't. Anytime we're talking...
I'm going to tell you what, there are a lot of people that swear by these things. And all I can imagine is a woman with long hair. And setting her hair on fire.
That is exactly right. Anytime you're talking about holding a flame up close to your head, I'm going to say that's probably a bad idea. I think sometimes people think that it's getting wax out because the candle is literally just melting next to their ear, but no, please don't do that.
I'm going to tell you what, we sell a lot of them.
You do?
It's amazing. I marvel every time I hear somebody tell me,
Can I get
works
a
great. I use them all the time,
Oh, my.
All right, I suppose we should take our first break here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Medicare open enrollment is going on now until December 7th, but selecting a plan can be confusing and stressful. That is why it is important to understand your options. We can help you figure out which plan is most economical for you. Call us and schedule an appointment to come in and have a free Medicare Part D plan consultation. Benefit from our pharmacist's knowledge, and you can save as much or more than $1,000 per year on your copays. Go to our website at medshoprx.com for more information. The Medicine Center Pharmacy's locally owned Health Mart Pharmacy in Canton, Louisville, Minerva, and New Philadelphia, caring for you and about you.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Wendy here from Studio Arts and Glass. We're all decked out for our holiday open house going on now through Thanksgiving. A huge selection of hand-blown glass ornaments, unique jewelry handmade in the United States, glass icicles in all shapes and sizes. All at pre-season 20% discount going on now through Thanksgiving. Extended holiday hours, Monday through Saturday, 9 to 6, and Sunday, 11 to 5. Join us for our holiday open house at Studio Arts and Glass, Apple Grove and 77 in North Canton.
Now's the time to make sure your blood levels are at healthy levels. This Saturday, the Canton Rotary Club and Mercy Medical Center will host a health screening and wellness fair at Mercy Medical Center from 7 a.m. to 11 a.m. in the auditorium. Get a basic screening panel for cholesterol, anemia, kidney, and liver function for only $40. Other low-cost screenings available include A1C, PSA, and vitamin D. Visit the Health Screening and Wellness Fair this Saturday, November 17th from 7 a.m. to 11 a.m. Call the Rotary office at 330-452-2882 or visit cantonrotary.org for more information. Welcome back to Health Matters with the Medicine Center Pharmacy. Today we're talking with audiologist Mitch Polen from Altman Hospital. I have a question posted on our live Facebook feed. So Mitchell, what are the different types of hearing loss? I know we've got our most famous radio broadcaster, Rush Limbaugh, with his cochlear implant thing and, all that kind of stuff. And so he's a different type of hearing loss guy than the average.
Absolutely. So he would have a sensory neural hearing loss. He would have a more profound version of that if he's wearing a cochlear implant. But a sensory neural hearing loss is basically when there's a problem with your inner ear or auditory nerve. So that could be something like damage to those tiny little hair cells we were talking about a little bit ago. Sensory neural hearing loss is by far the most common type of hearing loss you're going to see. It accounts for over 90% of adult hearing aid users. So obviously they benefit quite a bit from amplification. The other main type of hearing loss you're going to see is a conductive hearing loss. So this is when there's going to be a problem with your outer or middle ear, and essentially your organ for hearing is still intact, but sound, depending on the cause, for whatever reason, is getting slowed down on its way to the organ for hearing. So this can be treated medically, surgically, depending on, again, the underlying cause. And if there are no medical or surgical options, these patients tend to do really, really well with amplification. The third type of hearing loss is just going to be a combination of the two. So someone who has both a conductive and a sensory neural hearing loss.
Well, I think we've kind of covered this question. What are some of the most common causes of hearing loss? I think we hit most of them, didn't we?
Absolutely. Yeah, we talked about noise exposure, especially in this area, is a huge one. Long-term noise exposure, different ototoxic medications like chemotherapy drugs, radiation, infections, head injuries. Diabetes is a big one we found in recent years. There's a very strong correlation with hearing loss. So diabetic patients should definitely add that to the list of things that they should get checked. Stroke patients will very frequently completely lose their hearing unilaterally on the side that's been affected. And even when you completely lose your hearing on one side, as is the case with certain stroke patients again, there are still options for you to get help and hear better.
What about prevention? Any tips or good habits someone can employ to not let their ears take a toll from their environment?
Yes, we live in a very, very noisy world. There are many things that people do where you should be wearing hearing protection that you don't. Even when you're mowing the lawn, you should be wearing hearing protection. My wife and I, for example, we have one of those, I think it's called like a Fruit Ninja blender or something. We make smoothies every morning. It is incredibly loud, so I have a pair of over-the-ear hearing protection put on while it's running, because even that, a few minutes a day for several years, will eventually do damage. I mean, if you think back before, a couple hundred years ago, the natural world is a pretty quiet place. But now we spend all of our time around different noise, in the car, listening to music, watching TV. There's generators, fans everywhere. of course, a big thing, people need to be careful how loud they listen to their headphones. I feel like I'm somebody's parent saying that, but it's very true.
I was going to ask, so.
And having a properly fit pair of headphones is really important too. So like, for example, the ones that you get when you get an iPhone or when you used to get an iPod, those little plastic pieces that don't completely close off your ear, those are going to let the different environmental sounds in, and then what ends up happening is you turn the headphones up even louder to overcome that, and that's really when you start to get into some dangerous territory. So the over-the-ear headphones, kind of like you guys are wearing, are going to be ideal because they'll block out that sound. People aren't going to want to work out in those maybe, or do if it's really hot out, wear them. So get something, if you're going to wear something in the ear that completely blocks off the ear canal. And we make custom hearing protection for people. You can even make custom ear molds for headphones, where we would basically take an impression of your ear. The manufacturer would make this little ear mold, and then your headphone can snap right into it. So those kind of things are incredibly important. Hearing loss can be prevented by being careful around loud noises, but also if you start to notice troubles, it can be caused, again, by a lot of different things. So be proactive. Schedule that appointment sooner rather than later so we can hopefully stop it from progressing.
You mentioned that you formerly were employed by the VA, is that correct?
That is correct. So audiology has basically, it's called a fourth-year externship at the end of our doctoral program. It's basically the equivalency of like a medical residency. So I completed that up at the Lewis Stokes Cleveland VA.
Okay, now these guys coming back from the military, from the, shell shock, or not shell shock, but noise.
Oh, yeah.
Weapon noise, cannons, whatever.
Absolutely.
Is there a large amount of them up there being treated, or?
Oh, there's a huge number of veterans being treated. Even people who didn't necessarily see action. We have so many people who used to work on flight lines, for example, and maybe they didn't even wear hearing protection back then. When I would see World War II vets, they would say at most they'd put cigarette butts in their ears. Wow. And they're around these machine guns and different things. So it is, a lot of these guys went on to work in like factory type settings after they came home from the wars too, which is just going to add decades of noise exposure. So yeah, it's very prevalent in that population, and they fit a lot of hearing aids up there for those veterans.
I was in a mill not too long ago on a tour, and I was surprised at the amount of noise, these days.
Absolutely.
And I was thinking, looking at some of these fellows working there, I said, I was thinking to myself, geez, why don't you guys have something on your ears?
Yeah.
Some do, some don't, Some just risk it, I guess,
So it is now, OSHA requires you to wear hearing protection if you're exposed to something like 85 dB or over for 8+ hours a day. That started in the 80s or 90s. They rolled in and made it mandatory. But you're right, you'll still go places where maybe the guys aren't following those rules. And especially before that time period, nobody would wear it.
It's the person that thinks I'm immune.
Absolutely.
I'm tough. I'll be fine.
Yeah, exactly.
Okay, bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
We understand the one-size-fits-all approach doesn't always work. We do customized compounded medications based on your doctor's prescription to match your specific needs. Hi, I'm your pharmacist Brad White from the Medicine Center Pharmacy. Do you use or need customized compounded prescription medications because of allergies, special formulations, or need an easier way to take your medication that isn't available? Many physicians choose to prescribe a medication that is not commercially made and requires a pharmacy like ours with special equipment and training to prepare a capsule, suspension, cream, or tablet. Are you sensitive to lactose, dyes, or need a sugar-free suspension? The Medicine Center Pharmacy is here to help you. Every day we prepare custom medications for infants, adults, and pets in our PCAB accredited compounding lab. Call or stop by the Medicine Center Pharmacy today at 551 West High Avenue in New Philadelphia, where wellness begins.
You won't want to miss this upcoming Kiko Absolute Auction Wednesday, November 21st with auctioneer Bill Gill Jr. You'll find sports cards and memorabilia with many autographed items. Over 900 dolls from the 1950s through the 1990s, including Ginger Mouseketeer, Shirley Temples, a Madame Alexander Sound of Music set, and more. You'll also discover Hummels, Royal Daltons, coins, collectibles, furniture, goodie cards, and more. That's Wednesday, November 21st at 3 p.m. at 3201 Parkway Street in Canton. Call Bill Gill Jr. at 330-418-8727 or visit KikoAuctions.com for pictures, directions, and more information.
Wendy here from Studio Arts and Glass. We're all decked out for our holiday open house going on now through Thanksgiving. A huge selection of hand-blown glass ornaments, unique jewelry handmade in the United States, glass icicles in all shapes and sizes. All at pre-season 20% discount going on now through Thanksgiving. Extended holiday hours, Monday through Saturday, 9 to 6, and Sunday, 11 to 5. Join us for our holiday open house at Studio Arts and Glass, Apple Grove and 77 in North Canton.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today we're talking about hearing loss, hearing aids, tinnitus, and more with audiologist Mitch Polen from Alton Hospital. We've got a lot more to cover this morning, so let's get back to the show.
All right, before the break we were talking about preventions for hearing loss, and you gave us some really good tips about your protection and what to look for in your environment. What about tinnitus? We have patients that come in the pharmacy frequently, and they're frustrated by ringing in the ears, and there's a lot of discussions we can have, and I'm sure you can enlighten us from medications to probably environmental too, or even genetically, I'm guessing.
Absolutely. So first of all, you can call it tinnitus or tinnitus. There's no right or wrong. You can say it either way. It's not tendinitis.
My professor always said, just say it with authority.
You could say
it
either way, and it's right. But that tinnitus or tinnitus is something that is very common. It affects over 50 million people in the United States alone. We'll usually, if we're talking to patients, just ask if you have ringing in the ears. And this is going to sound different for people. It could sound like a hissing, a roaring, a buzzing, or like people say it sounds like there's crickets. And it's important to understand tinnitus is not actually a disease. It's a symptom of some other underlying condition of the ear. So this can be caused by something, again, like noise-induced hearing loss, wax buildup in the ear infections, cardiovascular disease, certain types of tumors like an acoustic neuroma, which is a tumor that grows on your auditory nerve, and certain medications like you asked about. So like aspirin's a big one, people who have been using it in high doses, long-term, every day, for a number of years. That has been known to cause tinnitus as well. When it's related to hearing loss or prolonged noise exposure, at least, it's basically a phantom sound that we hear. Nobody around you can hear it. It's just in your head. And for example, if you have heard of maybe a person who loses like a digit or a limb, they maybe get that phantom feeling that it's still there, or a different tingling kind of sensation. Our auditory system works in a very similar way. So when you get damage to certain parts of your hearing, a lot of times in those higher frequencies, your brain will fire in that particular area to try and fill in the gaps, and that's why you get those funny sounds in your head. It's nothing usually to worry about. I would still mention it to your doctor, and I would still recommend, if you do have constant ringing in the ears, getting a full hearing evaluation just so we can make sure nothing else is going on. But for the most part, it is not anything you need to worry about.
We have a friend, Gabe, we have a friend who's all of his life. Some of his family members also have it?
Yeah, I think they do have some type of genetic disposition, because they all have basically been told that over time they will go deaf because their hearing situation's so bad. But I guess it's like the constant ringing in the ears no matter what they've tried, or
really
nutritionally, or...
So yeah,
physical therapy or whatever.
There's different things that can be done. That's really tough, though. Everybody is, you're right, genetically predisposed at different levels, and that's something that's kind of outside of your control. There are things that can be done, though, for tinnitus patients. So if it is, suspect that it's caused by a medication, you're going to want to work with your primary care doctor to maybe lower the dosage. You can kind of weigh the benefits of that, or maybe try a different medication if there's something similar that maybe won't cause that tinnitus to worsen over time. For people who have it along with hearing loss, the vast majority of patients who are fit with hearing aids who have tinnitus, they're going to notice at least a major reduction in the intensity of the tinnitus while they're wearing the hearing aids, or a lot of patients will even not notice it anymore once they're fit with the hearing aids, because basically you are getting that input to your brain where I was just talking about is damaged, and it's trying to fill in the gaps. Once you fill in those gaps for it, you're not going to notice it so much.
Is there any relation of tinnitus to any other sensory taste, whatever?
No, not necessarily. There are other things outside of your ear that can cause it, maybe like a jaw misalignment. Like TMJ can give you tinnitus, but for the most part, it's going to be ear-related.
Okay. Same person we're talking about. Didn't you tell me he's losing his taste, sensory?
I don't remember if you said that or not. I think you might be right, though.
Yeah, I think you did say that.
I suppose if there's something affecting maybe your facial nerve, again, maybe like with a stroke patient, I'm thinking that could affect multiple things. But the underlying condition, if it's from the ear, I don't suspect would cause any kind of taste or smell or other disorders.
Okay. I mean, I see, as backing up a little bit here, I see almost every person running. If they're sort of a distance runner, they got headphones or earbuds in. And to me, that's critical if you're running, that you hear what's going on around you. You know, if you're riding a bike on the street, or if you're running on the street.
Yeah.
And it just amazes me how many of these people do that. And you know, I don't like to run. I never did, you know, but when I was running, my brain kind of ran 100 miles a second, you know. And I guess that's one of the reasons why these people wear these earbuds.
Right.
But to me, it's the hearing thing as a runner compared to vision is almost as important as vision in running or walking or whatever. But yet most of these people have their heads blocked with their ears blocked.
So they're called bone conduction headphones that you can get, and I do know some runners who use them. So basically these headphones will sit right behind your ears on your mastoid bones.
Yeah, okay.
And they're going to transmit the sound via bone conduction, so you can listen to like a podcast or the radio or music.
Okay.
But that's going to leave your ear canals open to allow those environmental sounds in.
Okay,
but you're right. That is, I mean, if you're on the street, especially if you're biking, that can be very dangerous to block off your ears completely. So a bone conduction device, you can get that at Best Buy or Amazon.
Okay.
People don't really know about them, but that can be a good option.
I always, when I approach somebody running and I'm driving, I always look at them. I watch them to make sure they don't step in front of me, and I've had that happen.
Oh, yeah.
Step in front of me and run across the street in front of me, and I think, you got crazy. You're lucky you're still alive.
Absolutely.
So, well, I went off the subject a little bit, but
Well, safety is important. So how about, it's probably about the time we start to talk about when you know if you might need hearing aids, or when should a person, obviously if they're having that discussion where you mentioned maybe their spouse or their loved one sends them in to see you, at what point is a hearing aid an option?
So that is the important thing. First, getting in to get the audiologic evaluation completed. That's going to be a critical factor in helping to determine the need for a hearing aid, because we're going to see if there are medical or surgical options, if there's a different underlying cause of the hearing loss. So once we diagnose the type and degree of hearing loss, then we will discuss with the patient whether or not they are a good candidate for amplification. This is going to be very patient specific, though. So you really have to help the patient work through this. You can have two patients with identical audiograms, so their hearing looks the same on paper, but one patient, for whatever reason, may notice just very little difficulty in almost any situation, and the other patient could have, for example, difficulty even conversing like we are right now. So that first person is probably not going to be motivated to wear hearing aids, doesn't need them as much if maybe they just have a mild high-frequency hearing loss, versus that second patient, again, for whatever reason, even that same hearing loss, they have a much harder time, would be a much better candidate. So yeah, we try to really determine a patient's need. That's something we work with them to do. But the first thing you're going to need is just to get a full comprehensive evaluation completed.
How about nutritional aids? For years, there was a practice in northeastern Ohio that recommended fluoride. Okay. Yes, no?
I honestly am not sure about that. Those are just because those kinds of things are so difficult to, I don't know of any long-term studies that have been completed on that, and nutritional studies in general are very difficult because there's so many variables over time that you have to account for. Even if you run a multivariate analysis, I'm sure it's really hard to pinpoint whether these people, if they took this every day for X number of years, ended up having better hearing. I don't know of any research done on that, but I wouldn't be surprised if there is something that would help to protect your hearing.
This practice recommended Florical, which you may or may not know about. It's not real popular anymore. But almost every patient that they saw, they recommended Florical.
Interesting. So that's something I would definitely want you to talk to your primary care doctor
and
about
that was
first.
Particularly after they did surgery. I believe that these fellas pioneered replacing the three small bones, hammer, anvil, and stirrup, that connect to the drum,
Absolutely.
And I believe that these fellas, in fact, my neighbor had that surgery, and he could hardly hear. They fixed his hearing. I mean, which is
right.
Just kind of,
It's amazing.
very interesting.
There are supplements that can be taken that some, like oncologists, for example, will recommend patients take alongside their ototoxic medications that they're being treated with, maybe for chemotherapy. And you guys might know more about this, but there are certain protective supplements that you can take while taking those drugs. I'm not sure of the exact mechanism behind how those work exactly, but I do know that some doctors will recommend those.
Well, this is not really related, but the statins are somewhat CoQ10. They destroy CoQ10, an antioxidant, and so most people on a statin drug for cholesterol are utilizing some level of CoQ10.
Right.
The hearing thing, I don't know, but
Right. Yeah. It's interesting.
Interesting question on the screen there. What have we got? 1:42. Maybe you can ponder this on the break. What causes vertigo, and what is treatment? So, I mean, that's a big.
It is a very broad question.
That's a big, broad question. So you might want to ponder that when we come back from the break, as to how many hours we could talk about that. So next up on the topic list is types of hearing aids, and we're kind of close to the break, but you can ponder that one too. But I know there's many kinds, and I know we were talking about Limbaugh earlier and the cochlear implant thing, and I saw him on television a week or so ago, and I couldn't tell if it was the special audio equipment he had that was kind of strapped or tied to the back of his head or above his ear. Is that
so he would have, for a cochlear implant, and we can get into that a little bit more in depth after the break here, but you actually have a surgically implanted magnet in your middle ear. So he has a sound processor that attaches to that magnet on the outside of his head. So that's probably what you saw him wearing.
Okay.
So yeah, that's
and that's permanently attached to his
no,
head?
you remove it at night to charge the
unplug
processor.
It. Okay,
Yep.
Gotcha.
Mm-hmm. Yeah.
Okay. Final breaks here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
The warmer weather is here. Hi, this is Brad White from the Medicine Center Pharmacy. Perhaps you've gotten the urge to venture outside and clean up the garage or do some yard work, resulting in muscle aches and pains. If you have sore muscles or aching joints, you may want to consider a prescription pain-relieving cream available with a prescription at the Medicine Center Pharmacy. Our pharmacist can work with you and your physician to get topical pain creams that can be rubbed directly on the source, reducing inflammation and pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory, and it is your source for custom medications. Custom compounded pain-relieving creams, available only at the Medicine Center Pharmacy, where wellness begins. Visit us at medshoprx.com for the pharmacy nearest you. That's medshoprx.com.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Now's the time to make sure your blood levels are at healthy levels. This Saturday, the Canton Rotary Club and Mercy Medical Center will host a health screening and wellness fair at Mercy Medical Center from 7 a.m. to 11 a.m. in the auditorium. Get a basic screening panel for cholesterol, anemia, kidney, and liver function for only $40. Other low-cost screenings available include A1C, PSA, and vitamin D. Visit the Health Screening and Wellness Fair this Saturday, November 17th from 7 a.m. to 11 a.m. Call the Rotary office at 330-452-2882 or visit cantonrotary.org for more information. Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Today we're discussing hearing loss, hearing aids, tinnitus, treatment, and more with audiologist Mitch Polen. Now we're going to get back to the show.
Why don't we try to address Madeline's question about vertigo and treatment options? I know it's complex, but maybe a thumbnail sketch for our listeners.
So, vertigo can be caused. Our balance system in general is very complicated because multiple systems are working together. There's our somatosensory, so how we feel our feet on the ground, that kind of thing. Our vision works with our balance very closely, and then our vestibular system, which is what we as audiologists are mainly going to deal with. And your vestibular system is housed in the same area as in your inner ear as your auditory system. So that's why a lot of times if something is going wrong with one, where you have vertigo, you might have hearing loss too, and vice versa. So many different things can go wrong to cause that vertigo in the inner ear. One thing, for example, there's a fluid basically that moves in the inner ear to help us transmit sound and hear, and if it becomes pressurized, if the pressure builds up, that can essentially stimulate your vestibular system when you don't want it to be, and that can cause a spinning sensation. Also, very commonly, I mentioned earlier, BPPV. This is a kind of positional vertigo that a lot of people get. Maybe they'll notice when they turn over in their bed to the right side, the room starts spinning. And basically, there are these tiny little crystals in your inner ear.
I was hoping you were going to mention the rocks.
The rocks, yes, the rocks in your ears. And they are housed in these tiny semicircular canals. And sometimes it can happen randomly, but it can also happen if you fall and hit your head, something like that. Those tiny little crystals will become displaced, and it basically just throws your vestibular system out of whack and can cause you to feel like you're spinning 100 miles an hour. There is a maneuver that audiologists and physical therapists will both do to help you through to reposition those crystals back to where they belong. But yeah, those are a couple common causes of vertigo. You can get it too if you have maybe a bad sinus infection that's pushing on your inner ear. But that's something you would definitely want to bring up to your primary care physician first to kind of start the process of what systems we need to look into next.
You know, with advancements in technology, I'm guessing that helping a patient choose a hearing aid is very individualized, and you probably have more options now than you've ever had before. Can you speak briefly maybe to how you help a patient choose what's best for them in their particular situation?
Absolutely. So there are there are still going to be basically two main styles of hearing aids, and one style is not better than the other. Like you said, it's going to be very patient specific. So one style, you would wear something behind your ear, and then either a tube or a very thin receiver wire is going to go into your ear. And the other main style is where both the microphones and the speaker are going to be built into one piece that goes into your ear. For example, a bigger in-the-ear version might be better for somebody who has some numbness in their fingers, maybe a diabetic patient who can't handle something smaller that maybe will go behind their ear. There's a lot of different factors like that are going to go into it. They can both be built with the same computer chips inside of them, though, so the sound processing is going to be similar. Your type of hearing loss is going to help determine which one we recommend for you too, but you're exactly right. That's going to be very individualized to the specific patient.
You know, I hate to throw this question out there, but why are hearing aids so expensive? People always ask me that question. Some more than others, obviously.
Absolutely. So this is a really big question and always has been a hot topic, and it's a very complicated question too, because there's a lot of variables that go into it. But it's important to talk about because, you know, there are still thousands of people in the United States even who desperately need hearing aids, and it would drastically improve their quality of life, but they simply cannot afford them. So starting with the manufacturers, as with a lot of digital technology over the last couple of decades, you know, the hardware components have gotten a lot cheaper. So you would expect the hearing aids to get cheaper along with that. However, where the main cost is coming from, where they are pouring millions and millions of dollars into, is research and design. And that's the reason hearing aids now are magnitudes better than they were even 10 years ago, but that also accounts for why the cost is not going down. So maybe some people would say hearing aids are good enough as they are. Why don't they just stop pouring this money into research and design? Then the cost can come down. But we live in a very competitive capitalist market, and there are several manufacturers always trying to one-up each other and make their product better and better. And as long as that's the case, they're not just going to stop where they're at now. So they're going to continue to put that money into research and design. So until maybe every manufacturer decides to drop out but one, I don't see that happening. There's other things that definitely factor into it. So most hearing aid clinics are going to bundle their services, meaning you're also paying for office visits, repairs, ear cleanings, manufacturer warranty. That's all going to be built into the cost. That's one thing, at least at Altman, that we're going to try to change in the coming months to hopefully provide a more affordable option for people, is to separate the device that people are paying for from our services. So basically, we'd like to offer an option where they pay for the device and maybe just the fitting of the hearing aid that first appointment, and then they would pay for follow-up visits as they go.
Just like going to the doctor.
Absolutely.
Yeah, it makes sense. Sure.
And what I would love to see as more and more clinics hopefully unbundle their services, I would love to see insurance companies, you know, they obviously don't cover the full cost of the device, but maybe as we separate the services, they can start to at least cover...
Guess what? We're out of time.
Very well.
Okay, I'm sorry to cut you off. Okay. Thank you to our special guest, Audiologist Mitch Polen from Alton Hospital. We'd like to thank our listeners. If you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsor, Studio Arts and Glass, Kiko Auctions, and, of course, our technical producer, J.D. DeAngelis. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. We are a local Health Mart pharmacy, caring for you and about you. Have a healthy week. We'll see you again next Friday night, right here on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.